Okay, so let's say there's a girl. She's in Minnesota. Let's call her Shannon, and Shannon wants to do a cleanse. I want to talk about, and really why I wanted to have both of you guys on, walk us through the whole roadmap and start 2 weeks before the cleanse. What are some things that she can do to prepare to have the most effective cleanse?
First of all, I would say 2 weeks before, this would be ideal. So if Shannon's like really up for a lifestyle change, and that's part of my job with functional medicine is meeting a person where they're at and kind of reading the room and the science and art of all of this. But ideally, I would like Shannon to prep where she's at. Well, I would decrease what I call the inflammatory core four. These are the four additives or foods that are most likely to mess up your microbiome, mess up your metabolism, drive inflammation levels. So that's going to be gluten-containing grains, specifically wheat. Look at refined wheat and how much you're consuming. Look at industrial seed oils like vegetable oil, soybean oil, canola oil, right? Grapeseed oil, maybe. Added sugar, which is probably the most, it's the hidden in the most things. So look at the grams of added sugar you're having in the day. Familiarize yourself with labels. And fourth would be dairy, conventional dairy. And there are better versions to all the things I just said. Like you can get like sourdough bread that might be a little bit more digestible. You can maybe look at grass-fed fermented dairies. But for the sake of simplicity, if she could in Minnesota decrease that inflammatory core 4 prior, it'll make the cleanse, whatever good, well-balanced, nutrient-dense cleanse we're talking about, it'll make it more easeful, don't you think, Lisa?
Absolutely. No, and I think then you're really setting yourself up for long-term success.
Right.
Because if you're going to make the commitment to the cleanse, you really are looking for change.
Yeah. And you're leaning into it. You're not sort of crashing through it and rushing through it. You're really setting yourself up for success. You'll actually feel better through it because you're going to start to balance your blood sugar, lower inflammation levels. So as you prep for the cleanse, it'll be a lot more effortless.
Alcohol?
It would be good to remove that
2 weeks before.
At least a week.
I would love that. I would love that for Shannon. I would love that for Shannon.
If Shannon were to drink alcohol, which alcohol would you steer Shannon towards?
I have my opinion. I'm going to let Dr. Cole
I want to hear your opinion, but I would say ideally prior, I would love if Shannon just did not have the alcohol because for a number of reasons. Alcohol is a neurotoxin. It messes up your gut microbiome. She will be prepping herself up for success. She will have a lot more of a blissful, enjoyable time because, again, during the cleanse, we're assuming she's having this clean, nutrient-dense foods that love you back anyways. So why not? But if she's going to have alcohol, I would say a low alcohol, dry farm wines would be wonderful. Low alcohol, regenerative, biodynamic, mold tested wine.
Just go buy the Gigawater box by Dry Farm Wines that I did with them.
I imagine
it's all safe.
There you go.
Most people a lot of people are leaning into cleanses for weight loss, right?
Yeah.
But from another health functional standpoint, like what are the other, like if you were going to convince me to do it and I said, hey, weight loss is not my main concern. Like what would be the things that you would sell me on to and think about a cleanse?
Well, it's interesting. I think you're right. A lot of people, it is weight loss, but there is a growing amount of people, it's more than that. It may be on the list of things they want to optimize, sure. But it's interesting the motivating factors, at least with my patients, it's things like fatigue.
Well, the reason I mentioned it to your point, not to interrupt, is because I think a lot of people when they hear cleanse, they think it's just weight loss. And I kind of want to educate people on that it could be a lot of other things
so
I'm sure
much.
You're going to talk about.
Yeah, exactly. And for people that think we're just talking about weight loss, it isn't. It's about getting healthy to maybe lose weight, not trying to lose weight to get healthy. Like it may be a natural byproduct for some people, but most of my patients actually, it's down low on the list, if it's on the list at all, to lose weight. It's more about feeling great in their skin. It's about this reconnecting how they want to feel in their own body and feel at peace with their body. So it's fatigue, it's things like brain fog, it's digestive issues, bloating. That's kind of the top things I would say.
Yeah, in the inflammation in the body. Like
the commonality, the commonality between all of these things is inflammation. So they're they may not word it like that, but that's what they want and that's what they can get.
And so the mechanism of the cleanse is it basically when you do it, it just gives your body enough time to rest and recover and clean out all the stuff that maybe shouldn't be in the body.
Yeah, you're avoiding things that are most likely to drive inflammation. You're nourishing your body with nutrient-dense foods that actually help to support healthy, balanced inflammation levels. Those are the two main prongs of how you're helping your body. And you're giving your body a break overall, however time a few days or however long you're doing it. You're giving your gut a reprieve to start to repair. And especially if you're implementing things like intermittent fasting, that's even more enhancing these sort of autophagy and cellular renewal pathways that we all have the capacity to do if we give our body the chance to do.